Good afternoon, Kieran, to you and to your viewers. So Friday the 13th is an important day in my life. The first symptom was a dry cough on a flight back from Melbourne after doing some business down there with some clients. The following 3 days or so, other symptoms started to settle in. I was vomiting on the Saturday. Temperature was obviously up and down for the next couple of days, and it was Sunday that I went and tested myself at St George Hospital. 2 days later I was told that I was positive and that I should go into isolation. Unfortunately, Saturday the 21st of March was the day that I was rushed to hospital by ambulance to St George and tried to put me on the oxygen. It was about 60 litres of oxygen. And a day later, they decided to intubate me and save my life.
Well, yes, indeed. Your family was told on 2 occasions that they might lose you. To prepare for that, the Maronite priest was brought in to say prayers with you. You were on the brink, and really not the cohort that people have been told is at great risk. As I said, you turned 50 after you got out of St George Hospital. Yeah,
look, that's true, Kieran. I was, twice there. My family was told that I may not make it through. So the priest was called to, I guess, pray for me the last prayers. But I fought through, and the great work of the hospital staff and the ICU staff at St George were fabulous. They got me through. I'm a fit and healthy person. I go to the gym 2 or 3 times a week. I didn't expect the virus to have an impact on me. I didn't even expect that I would be positive in any way, shape or form, but it is what it is, and the virus doesn't discriminate.
It doesn't discriminate, no, but from what you understand, and from the reports that we've seen of those that have lost their lives, generally they're in the older age bracket, and they have an underlying health condition, neither of which was relevant to you. Were the doctors surprised at how this floored you?
Look, the doctors were surprised, and they did tell me that much after I made a recent visit to the hospital to thank the staff. They did tell me that they were surprised that someone at my age with no preconditions or existing conditions that would be hit so hard. It still baffles me, and I'm talking to my GP to see how this has happened to me. But quite frankly, I think what people need to understand and appreciate is that it doesn't matter about how old you are or how healthy you are. Just take care and listen to the advice that's been provided by the health professions and by the governments, that COVID is real, and it can be very deadly. Your chances are 1 in 5, or as the doctor put it to me, it's a 50-50 chance. So it's a gamble.
So what's your perspective then on the risk of secondary outbreaks, of second waves, and also this debate we're having right now about the speed with which the state governments are easing restrictions?
Yeah, look, I have some reservations and some concerns about that. Obviously, my view is there will be a second wave, as has been the case in Singapore and places like that. And I'm noticing firsthand that people are becoming complacent. As I do my walks during the day or out to grab a coffee, I'm noticing that people have taken the view that it is okay, we're over the worst of it. And the social distancing is out the door. I have to say, social distancing is here to stay. And the sooner we realise that, the better it will be in saving lives.
You are a government relations expert. You've been obviously working in this field for many years. How do you rate the government, both federal and state, and the National Cabinet in responding to this crisis?
Oh, look, I think the Prime Minister and the Premiers have shown great leadership in this time, basically coming together and working together, irrelevant of their political differences or their political colours. I think it's an example to the world how it can be done in a system such as ours. And the Prime Minister and the Premiers ought to be commended for their strong leadership, and they put in the safety of their population first and foremost.
You were at a function with Peter Dutton in the days before you contracted coronavirus. Obviously, the doctors don't know exactly who you, contracted the virus from, but you were at a function, and of course we know he wasn't as sick as you, but he did fall ill with COVID-19.
Well, look, I attended a number of functions that week, and yes, I did attend a function with Minister Dutton, but his, announcement that evening on Friday the 13th that he was positive prompted me to take the test, which subsequently showed that I was positive. There are a lot of people that I interacted with, both here in Sydney and in Melbourne, on that day of doing business down there, and that week for me was predominantly fairly busy. There were events that I attended, lunches and dinners that I attended, and gatherings that I was part of. So it was pretty difficult to say who I contracted the virus from.
Yeah, indeed. Very hard to pinpoint that exactly. I'm wondering, in a broader sense, Joe Tannous, how has your outlook on life changed given this near-death experience that you've had?
Oh, look, the outlook on life has changed in a very big way. There is so much that I can do in terms of sharing my story with people, just to remind people that take care, keep the social distancing in place, look after your loved ones, the elderly, but also to appreciate that young people, such as my age and younger, can and are vulnerable to getting the virus, and should take exceptional care in everything that they do. Follow the instructions of the healthcare experts, because we have them there for a reason. They're there to provide us the expert advice, to listen to that advice and to apply that advice into our everyday lives. And I think secondly, importantly for me, my family was with me from the outset. They were holding vigil at the hospital. My outlook on life is family first. My business is important and it continues to grow, and my staff are safe and well. They're my priority at the moment, as are my 3 young children and my immediate family.
Well, Joseph Tannous, it's great to see you back fit and healthy, and you got to celebrate your 50th birthday, and I guess some of your family might not have expected you to do that at the worst of this experience, but we appreciate your time and your insights, a very unique insight in the face of this health pandemic. Thank you very much.
Thank you, Kieran.